The Dartmouth-Hitchcock Heart and Vascular Center provides state-of-the-art services in clinical cardiology, advancing frontiers of knowledge in cardiovascular medicine and training the next generation of heart and vascular experts. February is Heart Month, and Dartmouth-Hitchcock wants you to know about your heart health. This is the third in a series of podcasts called Get Heart Smart. Dr. Alan Kono, director of the Congestive Heart Failure Clinic and associate professor at Dartmouth's Geisel School of Medicine, is here with us today to discuss heart failure and to provide some Get Heart Smart tips. Thank you for joining us today, Dr. Kono.
Great. Glad to be here.
You have several areas of focus, including cardiomyopathy, valvular heart disease, and heart failure. Today's discussion will focus on heart failure. First off, can you describe to the audience what heart failure is?
Well, thanks. Heart failure is, it's actually called a syndrome, which means that many different diseases or conditions can lead to the condition. And it is actually a very common condition, and it can involve patients at many different phases of their life and age, and it actually affects both genders equally. And there's a pretty high risk that patients can develop heart failure over time.
Can you describe the symptoms of heart failure?
So it's a condition where people often have symptoms such as shortness of breath, fatigue, poor exercise tolerance, and fluid retention. And so this can be related to a heart that either is weak and not able to contract and pump blood flow efficiently, or the heart could be a stiff heart where it has difficulty in managing fluid and flow and pressure, and can lead to all those symptoms that I mentioned. And so people can then present with symptoms such as edema in their legs, abdominal distension, difficulty breathing, unable to breathe at night, perhaps the sensation of having to urinate at night or more frequently. A patient has these new symptoms, it is really important that they seek medical care sooner rather than later to find out what it is that's causing these symptoms, because sometimes they could be life-threatening, and early diagnosis makes a big difference in patients.
And generally, what causes heart failure?
So heart failure can be caused by many conditions. The risk factors include high blood pressure, diabetes, a history of coronary disease or prior myocardial infarction, valvular disease, patients either born with a congenital heart problem, patients who acquire valvular disease such as rheumatic fever, or valve disease that is acquired later in life either due to aging, trauma, infection, or certain types of rare diseases. It can also be a condition that runs in families, and so patients who have family members who have heart failure or other heart muscle problems such as cardiomyopathy could be at risk. And so it is important that patients understand their own family history, because that's something that could play in our understanding of the condition and the workup. I think it's important for patients to understand that there are modifiable risks to include other causes of heart failure, such as substance use and chronic infections, and it is important that you minimize your risk with healthy lifestyle.
How can heart failure be prevented?
So heart failure, many forms of heart failure can be prevented with good heart-healthy interventions. And of course, that includes making sure that if you have cardiac risk factors, that they are addressed, especially if they're modifiable. Knowing your family history is important so that you can be aware of new symptoms, especially if some of these conditions occurred in other family members who are younger. Making sure blood pressure is under good control, making sure that if diabetes is diagnosed, that that's treated, making sure that patients watch their weight and trying to fight obesity. And exercise is important, making sure that patients are able to keep active, make sure they have good exercise in their regimen. Also avoiding excess in alcohol use and avoiding tobacco use is really important.
What should we do if we're diagnosed with heart failure?
So heart failure is a serious condition, but if we identify patients early and we make a diagnosis and can find the treatable causes of the condition, that's really important. But it's also important to know that we have therapies that can improve how patients feel and, more importantly, actually modify the disease and improve prognosis. So an earlier diagnosis, getting placed on appropriate therapy to address the underlying causes of it or the risk factors associated with it, and then making sure that there's adequate follow-up to make sure patients are actually getting better and to avoid sort of acute problems that might arise because of the condition. And so making sure that you partner with your physicians and providers is really important, because this is a team effort in managing a condition like this. And it is a condition that is with it a high mortality and a high risk for further need for aggressive treatments over time.
Can you please give us some heart-healthy tips that we can use in relation to heart failure?
So another thing I forgot to mention is a healthy diet. And so making sure that patients have a low-sodium diet, avoid processed foods, watch their calorie intake, and have adequate hydration. These are really important things. It's also important to understand the medications that a patient is on, because sometimes it might interact with other medications. We want to avoid certain types of over-the-counter or herbal medications that might interfere with the metabolism or cause interactions or side effects. And again, having a healthy lifestyle with good exercise, adequate rest, and making sure that appropriate follow-up with providers are kept.
What are the takeaways that you want the listeners to know about heart disease?
It's actually a very serious condition. Its risk of bad outcomes or high mortality is very high. But the take-home is that with therapy, the condition can be managed. We can't cure most of the things that cause heart failure, but we can certainly manage it with good medical therapy and good sort of lifestyle adjustments, and making sure that patients are seen by professionals who know and understand this disease and can offer therapies that will help them.
Dr. Kono, thank you very much for joining us today and providing heart-healthy tips and information on heart failure.
Thank you so much for having me. It's been a real pleasure to be able to speak to you.
For more information or to attend a Get Heart Smart event in your area, please visit d-h.org/heartsmart. Thanks for listening.